your stances on abortion, there will be something in this video that you agree with. I don't want to debate whether abortion is right or wrong. Abortion is a complicated moral dilemma that varies from situation to situation. Let's take this hypothetical as an example. There are two women who are both 9 weeks pregnant, but both are in very different situations. Take this first woman as an example. Her name is Mary, and Mary has a husband, and they're both financially stable. But unfortunately, Mary and her husband get into a car accident, which results in a miscarriage. In the second scenario, Jane gets pregnant from her boyfriend, but her boyfriend leaves her and she's not in a stable financial situation. So unfortunately, she has to make the decision to get an abortion for the sake of herself and the child. In both scenarios, Jane and Mary lost a pregnancy due to outside forces, just different outside forces. This hypothetical situation shows how abortion is a value-based issue, and you will place judgments on these situations and these people based on your own personal moral code. This is why I cannot debate whether abortion is right or wrong. It purely depends on the personal beliefs of the individual person involved or the individual person viewing the situation. The main issue I am focusing on are excessive abortion restrictions, which have had unexpected impacts in multiple different ways. Some of the impacts I will be covering in this video are impacts on healthcare, economics, and politics, and personal impacts as well, and personal stories from people who have been deeply affected by these restrictive laws. I will also be highlighting specific discussions held in Congress that has changed the way that reproductive rights and reproductive health care has been viewed in a political sense, and how that has affected healthcare. My goal for this video is to have a discussion that incorporates multiple different viewpoints so that we as a society can come together to solve these issues and help those in our communities who are struggling. So, what happened in 2022? In 2022, Roe v. Wade was overturned by the Dobbs decision, which took abortion rights from the federal level down to the state level, allowing states to incorporate these different types of restrictions based on what their voters believed or their personal beliefs. Abortion has been a hot debate topic for decades, but the recent Supreme Court decision has spurred an even more intense debate. Many different viewpoints have come to the forefront of this debate, and it has continued to rise in intensity. Some of the opposing viewpoints range from religious views on abortion, views that say abortion is used as a form of birth control instead of just a medically necessary practice. And then others say that abortion is just the murder of a child, and this can be from a religious standpoint or just personal morals. Other viewpoints center around the women being able to make a choice on whether or not she wants an abortion, or just that abortion is a necessary medical practice, which is more so the stance that I am taking in this video. It has been about 3 years since the Dobbs decision, making this an opportune time to discuss how abortion restrictions have impacted local communities. We can clearly see how restrictions have affected communities over time and how they might continue to impact communities, which is especially important when dealing with the health and welfare of mothers and children. So moving on to effects on healthcare, abortion restrictions have caused more deaths in local communities, as shown through a study done by the National Library of Medicine and also a research article from the health journal Contraception. Maternal mortality rates have risen in states with restrictive laws compared to those in protective states, and additionally, unsafe abortion practices have increased in these areas, which contribute to death rates. This comes from desperation from mothers who are either teen or just young mothers or single mothers who are unable to have a child and no longer can access abortion, or who are afraid of people finding out about the pregnancy in the first place due to stigma surrounding issues like reproductive health and reproductive rights. Infant mortality rates have also increased because of the changes to these practices and because of the decrease in quality of maternal and prenatal care. A lot of mothers are no longer seeking prenatal care due to the stigma around reproductive health care and because of the decrease in quality, so it's no longer worth it. The stigma surrounding reproductive health care has also influenced doctors in their practices. A study done on practice location preferences after the Dobbs decision from the Journal of General Internal Medicine shows that people training to be doctors have changed their location preferences post-Dobbs decision. About 76% of trainees in non-restrictive states said that they would not choose to practice in a restrictive state. 61% of trainees in complete ban states said that they would also not choose to practice in a restrictive state, and then about 56% of trainees in early ban states said the same thing. Very few trainees overall, about 11%, said that their location preferences have been unaffected by the DOPS decision, showing how very few trainees, about 11%, said that their location preferences remain unaffected by the DOPS trainees will no longer go to those states. That doctors and trainees are not going to restrictive states, which lessens the access to family medicine practices and lessens quality of healthcare since new doctors are not coming to these medicine practices. Most doctors in restrictive states have reported significant changes to their practice, both in how they deal with patients and how they deal with legal issues. Doctors also report more worries about legal risks when consulting with patients due to clarity issues when it comes to new laws. Overall, there has just been lessened access in these counties and communities, and an analysis from the Commonwealth Fund on how abortion restrictions have affected local counties demonstrates some of the effects on maternal care. Our analysis shows that 39% of counties in abortion restriction states can be considered maternity care deserts compared with 25% of countries in abortion access states. A maternity care desert means that there is little to no access to maternal or prenatal care in these areas. This is a huge problem since prenatal care is vital for the safety of the infant and for the mother. The statistic demonstrates that healthcare has been lessened over time in counties compared to states who have less restrictive access to abortion. This comes as a direct result of changes in practices, fear from doctors and patients, and a lessening of the quality of care overall. Some believe that these restrictions are necessary so that the lives of children can be protected, but the actual impacts of these laws are having the opposite effect. More children are dying, more mothers are dying, and overall healthcare quality has just decreased. Conversations held in Congress between politicians have also had a major effect on healthcare issues, mainly due to a lack of definition on what is considered a necessary or not necessary abortion. Specifically in Louisiana, this has impacted the ability of a woman to get life-saving medical care that both her and her doctors agreed she needed. This was purely because of a lack of clarity from the Louisiana legislation, who would not define what was deemed medically necessary. This is also because abortion has been now labeled as a reproductive right instead of a medical practice, which in some circumstances it is a necessary medical practice. For example, if a woman has a miscarriage and she's not able to fully miscarry on her own, she would need an abortion in order to safely live or continue to have children. This is why abortion is medically necessary in specific circumstances. The federal government is also paying more per year to accommodate these restrictions. The IWPR estimates that the United States federal government is paying an average of $173 billion per year on abortion restrictions alone, and that's only on abortion restrictions. This money could be used in much better ways, like improving the lives of those in local communities or improving healthcare in those communities, improving schools and education, improving the lives of children, for the lives of children who are in foster care. All of these different things this money could be used for. This in turn leads to economic loss in the states as well. This image shows a percentage of loss in GDP per state, and as you can see, states with more restrictive laws have had a higher economic loss. This also leads to higher medical costs and limiting care for lower income people. The impacts of these restrictions are primarily concentrated in rural area, which mainly affects lower income people. This is well said by members of the IWPR. In states where abortion is banned, women work more hours per week, have a lower income, become mothers earlier, and give birth to more children. Access to abortion is especially important for economically vulnerable groups. Denying abortion increases poverty among individuals. And this is a statistic from the IWPR on poverty and abortion. And increased poverty in a time where economic hardship is already an issue may place additional unnecessary burdens on people who are already struggling. So there are a lot of individual examples of how these abortion restrictions have affected people personally. For example, we have Nancy Davis and Caitlin Joshua. And these are two women from the state of Louisiana who are denied medically necessary care, abortions. Both women were already mothers who were looking forward to the birth of their new children. Davis already had 2 children and Caitlin only had 1, but they were very excited for the birth of their new children when complications occurred for both. Both women needed an abortion due to these issues that happened with their pregnancies. And due to the heavy restrictions in Louisiana, both were denied care, which could have ended in death or serious fertility issues. In Davis's case, she was told that she would need to give birth to her dead baby instead of being offered the option of having an abortion, which added unnecessary additional pain and hardship to an already very difficult situation. I could never imagine having to give birth to a child that I already know is dead just because of politicians being unable to define whether or not an abortion is a necessary medical practice, when obviously it is in some circumstances. And in Caitlin Joshua's situation, she began to miscarry at home and sought medical care to ease the pain and bleeding, but was ultimately denied. This miscarriage could have turned fatal at any point, and it has in the cases of other women in states with excessive restrictions. Caitlin Joshua was very lucky that she did not have to deal with any long-term effects due to this miscarriage, but a lot of miscarriages can turn fatal or extremely injurious, again showing how abortion is very medically necessary. Both stories show how abortion is not another form of birth control, but is necessary in some situations for the safety and life of the mother. So this is Reverend Rob Sneck. He started out having an absolutist view on abortion restrictions and was the forefront of the pro-life movement, starting in, I believe, 1990, 1980 through the early 2000s. So he was a very prevalent figure in the pro-life movement. But he realized that how damaging heavy abortion restrictions can be. And he realized this through discussions with many different people and their experience with these restrictions. And he was able to come to common ground and relate with a formally opposing point of view, and still maintaining his religious point of view and his reverend status. Schneck's story is a great example of someone having a religious view that abortion is immoral, but still understanding how this practice can be medically necessary in specific situations, and giving grace and forgiveness to those he could believe are immoral because they went and received an abortion. Schneck is not the only person who is able to find common ground across viewpoints. Interviews of women on college campuses and show how other people were able to relate and agree, even though they are on opposing sides. Although I would never choose to have an abortion, I do not think that abortion should be illegal. And this is from Stephanie at Winthrop University. And then Isabella from the New School says that I still believe that life begins at conception, but that doesn't mean that I don't understand the need my best friend had when she made the life-changing decision to terminate her pregnancy. It was the right thing for her to do at the time, and I supported her 100% because pro-choice means having the freedom to make my own choice while letting other people do the same. My own personal story and experiences were also part of the inspiration for this video. I am the daughter of a teen mom who ended up having to raise me by herself. In 2004 in Louisiana, my mother got pregnant with me at 17, even though she was taking proper precautions. She was on birth control and she was taking other precautions to make sure that she wouldn't get pregnant because she knew that she was unable to take care of a child at this time. At this time, she was unable to get an abortion because she was a minor and my grandparents did not believe in abortion. Even though I am eternally grateful for the life that I have, it is extremely difficult to be a single young mom in the United States. There's a lot of prejudice, assumptions, and lack of resources for those who are struggling, and my mom fell under that category. She had to work much harder than most parents to give me the same opportunities as my peers, and she ended up missing out a lot on my life events as a result, and her own life events. We both lost time together because of a lack of resource for struggling mothers. This is why abortion is important. Quality of life for both the mother and child will go down if the mother is not ready to have a child. And I am a good example of that, and my mother is a good example of that. Even though we have privileges and opportunities that she worked really hard for, it was unfair for her to have to take so much time out of her life and my life in order to give me those opportunities that should have been readily available. A Bible verse sums up my points well. Be kind and compassionate to one another, forgiving each other, just as in Christ and God forgave you. And this is from Ephesians 4:32. The only way to truly help those who are struggling in our communities is through helping one another and coming to a solution with one another without judgment. Debating on the morality of abortion should not be the forefront of this discussion. It should be about the welfare of everyone in our communities. This includes mothers, children, fathers, doctors, politicians, everyone. These excessive restrictions have added to a lack of welfare that a lot of places and people were already dealing with, meaning that these laws often fail at addressing the complex needs of those involved. Ways to deal with these complex needs would be increasing available resources for low-income mothers and children at any age, which will help decrease abortion rates and improve the lives of families in these communities. Additionally, education on reproductive health will also help people understand how to be safe and will help people avoid unwanted pregnancies, for example, family planning. These are excellent ways to address the issues of abortion and the issues brought up by multiple different viewpoints regarding abortion. Thank you for watching, and make sure to join this discussion in the comments.